Welcome to The Explainer. We're all about taking tricky subjects and making them super clear. And today we are diving headfirst into the world of health advice to figure out, who should we actually be listening to? Have you ever felt totally lost in a sea of conflicting health info? Yeah, you are not alone. It feels like every single time you go online, you get hit with some new contradictory rule about how to live your life. So one minute you're hearing that seed oils are basically the worst thing for you. And then, the next, you stumble across a video that completely debunks a big cancer study that you've just heard about last week. And then, just to add to the confusion, a podcast tells you that building muscle is the absolute key to everything. It's a lot, right? It's confusing, it can be really contradictory, and frankly, it's just exhausting. So let's try to bring some clarity to all this chaos by mapping out this whole new world of information. Okay, so first up, let's talk about the giants in the room. The big established institutions that have been guiding public health for, well, decades. You know who I'm talking about. Organizations like the CDC, the American Heart Association, you can think of them as the foundational pillars. Their whole job is to provide really broad guidance that's meant to be safe and effective for pretty much everybody. And the scale we're talking about here is just staggering. That number, that's over $6 billion. And that's just what the American Heart Association alone has invested in scientific research. It just goes to show the massive resources they pour into this stuff. And because of that, their approach is kind of like a giant encyclopedia. I mean, you can go to their websites and find pretty much everything from A to Z. You've got official guidelines, outbreak data, research journals, even healthy recipes. It's the whole shebang. So here's the bottom line. Their information is designed from the ground up to be a trustworthy, safe starting point for the general public. It's the bedrock, the baseline. Okay, so we have the bedrock. Now let's pivot and look at a completely different type of source, this new wave of experts who are really shaking up the health conversation online. I'm talking about PhDs and MDs, like Dr. Rhonda Patrick and Dr. Gabrielle Lyon. These folks are the pioneers of the deep dive. They're using podcasts and videos to translate really complex, cutting-edge science into advice you can actually use, often focused on things like longevity and peak performance. And this quote here from Dr. Lyon just nails their whole philosophy. No fluff. Their approach is all about getting straight to the point, having these really focused talks with the actual scientists who are doing the research right now. And you can totally see that in the kind of content they create. It's not that A to Z list of conditions. It's more like a curated playlist of really specific, often provocative deep dives designed to answer very particular questions about how to optimize your own biology. So this is where you can really see the difference in style, right? The institutional bedrock gives you the official guidelines, the what you need to know for general safety. The pioneers, on the other hand, they're exploring the why something works and the how you might actually apply it to your own life. Okay, so we've got these two very different sources. One is super broad and foundational, and the other is super deep and specialized. So how on earth are you supposed to use them together? Well, the best way to think about it is not as a competition. It's not pillars versus pioneers. Instead, think of it like you're building a toolkit, and each one of these sources is a different tool with a very specific and very valuable purpose. This table really breaks it down perfectly. You use the institutional bedrock for that broad, foundational knowledge, the stuff that's true for almost everyone. But then, when you want to deepen your understanding on a specific topic that you care about, that's when you turn to the new communicators to explore the cutting edge. So here's a really simple but powerful strategy you can use. Step 1, start broad. Use a source like the CDC to get the basics. Step 2, go deep. Search for that same topic with the science communicators to get the nuance and latest research. And then, step 3, and this is the most important one, consult a pro. Always discuss what you've learned with your own doctor to make a plan that is right for you. And all this really leaves us with a final thought. In an age where we are just drowning in information, maybe the biggest challenge isn't finding answers anymore. Maybe the real skill is learning how to ask better questions and using this whole toolkit to build a more complete, a more personalized picture of your own health.